Number H2205 and S1385. Welcome, Senator and Dr. Atkinson.
Thank you so much, Chair Domb, Chair Velas. I'm glad to be here testifying before your committee with Dr. Atkinson, who is, it should be said, a shared constituent with myself and Chair Domb. I'll speak first and then you'll hear directly from Dr. Atkinson. So again, Chair Velas, Chair Domb, members of the committee, thank you so much for hearing our testimony in support of S1385 and H2205, an act expanding loan repayment assistance for primary care physicians. I happen to have filed this bill with Chair Domb in our partnership. So thank you, Chair, for being my House partner in arms here. And I'm really happy to be speaking in support with Dr. Kate Atkinson. So as the chairs know and the committee knows, Massachusetts is facing a pretty significant primary care crisis. In Western Massachusetts, we feel it even more acutely. But according to the Health Policy Commission, patients in Massachusetts reported worsening access to primary care each year from 2019 to 2023. In many cases, new patients in our state wait more than twice as long for primary care appointments as patients in other states, with even greater, again, disparities in low-income communities and rural communities. The primary care crisis is one of the issues that I hear most frequently about from constituents, both from patients struggling to find care and providers, and also providers who are, burned out, frankly, and overworked by huge panels with really complex needs and not enough monetary support. We know that a strong primary care system improves health outcomes and reduces costly emergency care. But right now, relatively low pay and the burden of medical school debt are pushing too many physicians away from this field. And with the federal government making student loan forgiveness harder to access, I believe we have to pick this up at the state level. So this bill is actually quite simple. It expands eligibility for the Commonwealth's main loan repayment program. It's called Mass Repay, MA Repay program, so that more primary care physicians, including OBGYNs, can access support. Now, community health centers are essential pillars of our healthcare system, and the current program rightly prioritizes doctors who work in community health centers. This bill builds on that foundation by ensuring that additional practice settings, so long as they serve significant public payer patient population, can also benefit from this vital workforce incentive. And of course, I know the chairs understand and the committee understands that should we advance this legislation, we have to commit to ensuring there is sufficient funding for it in order to not inadvertently box out community health centers, but to just expand the pie, if you will, and the eligibility to the pie. So again, in closing, I would just say if we want to retain and grow our primary care workforce and meet the needs of our residents, and I know you want to, we have to make it more financially viable to choose and stay in this profession. And that's what this bill and any accompanying funding will help us do. I'm grateful that the Mass Medical Society has offered this bill its really strong support and supporting also other legislation to strengthen primary care workforces and services. And I look forward to hearing from Dr. Atkinson and taking any questions from the committee. Thank you so much.
Thank you, Senator. We'll hear from Dr. Atkinson, then we'll come back for questions to either one of you, if that's okay. Dr. Atkinson, are you there?
Hi. So
Welcome.
I'm a family doctor in private practice in Amherst and Northampton. We have about 8,000 patients who come to us for our medical home. We're really proud of the care that we provide. It includes integrative behavioral health. We treat patients with substance use disorder. We provide counseling. We provide psychiatric medicines, and we keep people out of the emergency room. We've been doing that for 15 years. Most of the ER docs at our hospital say they never see our patients. When people don't understand how important what primary care is as we really know patients and we take good care of them and we prevent disease, we actually circumvent the need for most of the other services that cost so much more money. Over the years, I have made it a point of always teaching medical students because I want them to see how much fun primary care is. And they do come and think it's a lot of fun. They leave a rotation at our office saying, this is what I want to do. I want to take care of whole families and hold babies and really take care of a community over the years. And then inevitably, a year or two later, I get an email from that student saying, I'm really sorry, I've run the numbers, and I'm gonna have $300,000 in debt, and there's no way I can be a family doctor. So they go into a high-paying field. And this happens again and again and again. And I feel like nobody has really responded to this because they assume that all doctors are rich, and they don't understand the huge disparity between what a primary care doctor receives and most other medical subspecialties. I've been unable to recruit doctors. Most of them either want loan reimbursement or to go somewhere else. And most of the people in primary care have left primary care to go to more lucrative settings like concierge medicine, direct primary care, aesthetics. In our area, doctors are injecting Botox in people's face, but there's a wait of at least a year to see a primary care doctor, 6 months to see an OBGYN in our area. We have 800 people on a waiting list at our office, and I don't know when we can start accepting them on. Every day I receive frantic emails from people in the community begging me, couldn't we please take them, their child is sick or whatever. Over the years, I watch our legislature, who has not always understood the importance of primary care, thinking that if they license nurse practitioners for independent practice or encourage more urgent care centers, that will solve the problem. But it doesn't solve the problem. A medical home needs a doctor with the 7 to 8 years of training that we have to oversee the other subspecialists. I mean, we work in our office as a team. We supervise what the PAs and NPs are doing and provide better care because of that, including our psychiatric support and the other supports that we have. In the past year, our money has gotten so tight that we had to cancel our Saturday hours, which means that now more patients will end up needing to go to the emergency room, which costs more money. This is pivotal legislation that would make a huge difference to keep us sustainable and maybe even attract people to stay in the state. They go to UMass Medical School, they get accepted into the PERCH program because they want to do primary care, and then they can't stay either in Massachusetts or in primary care. So upstream, this will make a huge difference. So thank you very much for hearing me.
Thank you so much, Dr. Atkinson. Are there any questions or comments for either the senator or the doctor?
Well, just a brief comment to both the Senate author as well as the House author of this bill. Just thank you for always kind of adding a perspective about things that are Commonwealth-wide as opposed to just certain areas of it, right? We frequently talk about different parts of the Commonwealth. These challenges present differently, so thank you for always highlighting them.
Why, thank you, Mr. Chair. I like to think Western Mass is a little bit of a canary in a coal mine situation. Thank you so much, Doctor. Thank you, Senator.
Chair Domb, can I add one more thing?
Please, go ahead.
Recently, I went with the Massachusetts Academy of Family Practice to testify to other legislators and talk to people in the Fall River area and the Lawrence area, and their primary care is just as strapped in very similar ways. And I felt like we were all speaking the same language. Eventually, it's going to happen to everybody, and we really do need to listen. Thank you.
Thank you so much.